Welcome back. You're watching Network Africa. You can watch us on youtube.com/channelsweb. You can also watch us on m.channelstv.com live on your mobile device, especially for our viewers outside West Africa. You can watch us from any part of the world by logging on to m.channelstv.com. We advise you to download the Channels TV app for Android, iOS, and Windows phones from their respective stores. The United Nations says South Sudan's unity state could face severe famine, and 3 UN agencies have already warned that extreme hunger is pushing people to the brink of terrible incidents in parts of South Sudan. A new analysis found that 3.9 million people nationwide now face severe food insecurity. With the rainy season making roads impassable in South Sudan, the World Food Programme, WFP, has been airlifting food across some parts of that country.
The World Food Programme helicopters spotted airdropping food in the Unity State of South Sudan. The United Nations mission in South Sudan, Mongolian battalion and military liaison officers provide force protection and crowd control capability to ensure safe collection, loading and delivery of the supplies to World Food Programme logistics base at the United Nations mission in South Sudan, Bentiu compound. The battalion has been doing their best, carrying an operation of about 7 to 8 hours a day, without a concerted effort by the aid agencies. Over 30,000 people in South Sudan's war zone regions face death by starvation, and more are on the brink of famine. Children and women are mostly on the receiving end of this crisis. The United Nations Food and Agriculture Organization, the United Nations Children's Fund, and the World Food Programme called on the parties to the conflict to grant urgent and unrestricted access to Unity State, where humanitarian assistance has been hampered by the dreadful violence and lack of access in recent months. Some displaced families say they survive on just 1 meal a day, consisting of only fish and water lilies.
People don't have adequate nutrition. They don't have adequate access to food. In most cases, when they are fleeing and when they have moved to locations which they call a safe haven, the only thing that they can rely on are the roots from the swamps. And so they're very limited amount of food. And what we're seeing now are famine-like conditions in those locations where humanitarian assistance, where agencies like us, WFP, have not been able to go.
The government of South Sudan in a press conference said that the government is committed to the implementation of the recent signed compromised peace agreement and working hard seeking a lasting peaceful solution to the ongoing political crisis so that humanitarian and developmental work may continue.
We are also fully committed to ensuring enhanced trade in all areas of the country, uninterrupted access for the humanitarian aid, and an enabling environment for the people to return to their homes, to rebuild and recovery on their livelihoods.
Human Rights Watch has released a report which shows that people with mental health conditions in Somaliland are increasingly forced into institutions where they face serious abuses and poor conditions. The 81-page report, tagged "Chained Like Prisoners," detailed abuses against people with psychosocial disabilities in Somaliland. It detailed how men with perceived or actual psychosocial disabilities actually face abusive restraints, beatings, involuntary treatment, and overcrowding in private and public health centers. Most are held against their will and have no possibility of challenging their detention. In private centers in particular, those with psychosocial disabilities face punitive and prolonged chaining, confinement, seclusion, and severe restrictions on their movement. Now, the author of this report, Letitia Beda, she is a Human Rights Watch researcher for Africa Division. She joins me now live from Kenya. Thank you so much for making our time to speak to us on Network Africa. I mean, you wrote this report. You've been to these camps across Somalia. give us a feel. What is it like, and how would you describe these people?
Well, these centres are often inside housing, so very cramped conditions, very limited compounds, and as a result, a lot of the individuals inside are actually chained inside their rooms for prolonged periods of time. They have very limited activities. There is no counselling going on. And one of the individuals who I spoke to inside actually said to me that he appreciates the days where he gets to clean his room because, you know, it's a very limited activity he actually gets to do inside these places. In terms of who we're speaking about, I mean, obviously, rates of mental health in Somaliland are believed to be amongst the highest in the world. There aren't very official data, so it is still difficult to say really how large the rates are. But I mean, I was surprised in the course of this research how many families are actually caring for, supporting not only one individual with psychosocial disabilities, but entire generations and often cross-generations of men who have some sort of mental health condition. And this is believed to be linked to the trauma of the civil war, the lack of public health facilities, but also the widespread use of the stimulant cat, which is believed to trigger mental health conditions, but also convert underlying depressions, for example, into psychotic conditions. So at the same time, we also have individuals in these centres who are being put inside these centres because their families want them to stop chewing cat. So you have a whole range. You also have quite a few individuals who've actually been sent back from the diaspora. There's a very big diaspora in the UK, in Sweden, and individuals who are believed to be acting in a way which is not culturally appropriate, whether it is with mental health problems or drug abuse, are actually sent back inside these centres.
I mean, looking at the pictures here, you can tell the place is either super secluded from the major city. Is the government aware of these detention camps and the mode of operations there?
Well, they're actually inside the heart of the city. I mean, this is one of the reasons why we decided to focus on the private centres. Wherever you go around Hargeisa, you have these centres. And so, you know, these are not hidden from the public, or at least they shouldn't be. But the reality is the government is not monitoring what's going on inside. And so what we're saying is, at a minimum, the Ministry of Health, which has actually identified mental health as a priority, needs to start visiting these centres. I mean, we're not talking about thousands of centres. We're talking about dozens inside of Hargeisa at the moment. We're talking about hundreds of individuals inside these centres, and they need to be going there. They need to be making sure that the worst abuses are stopped immediately, notably chaining. I mean, chaining is used on a widespread basis. It's used on admission. It's used as a form of punishment. Also, we're seeing beatings of individuals who are not acting in a way which the guards want them to act, who refuse to take their medication. We're seeing massive over-sedation of individuals. So there are some very concrete changes which need to happen immediately, and the government could make a real impact if they started to visit these centres.
Now, these centres are obviously set up to help these so-called social disabled people act better. Can you give us a sense of how well they recover, having gone to these kind of detention camps? In your report, I saw one man who used to be in the detention camp who's been narrating his own experience. Can you help us to understand how many people do get out of there and do get out well?
I would say yes and no in terms of actually these centres provide